Hi, welcome back. I am Dr. Renee, and we are still here on Meharry Media Day. And today now we get to speak to Dr. Sheree Farmer-Dixon, and she is going to tell us what she does here at Meharry Medical College.
Well, I am the dean of the School of Dentistry here at Meharry.
Something is hanging.
Oh,
Okay.
okay. All right. Thank you.
You're welcome. I was like, wait a minute.
Can't have that.
No, can't have that. So, what specific oral health disparities do the Black community do you notice that we have?
What I noticed, and the first thing that I want to say is the head is connected to the body. And since it is connected to the body, what goes in the mouth can actually affect what happens not only in your mouth, but in your body. And unfortunately, one of the what we see is a lot of caries, a lot of gum disease. That
Let me interrupt you. What are caries?
Okay.
Our audiences.
Caries is cavities.
Yep.
And cavities is the most common chronic disease that is preventable. But there's this myth that people think that my grandparents lost their teeth, my parents lost their teeth, that's naturally supposed to happen. The teeth are made to last a lifetime, but we have to take care of them. And so it's unfortunate, but we see a lot of cavities in the African American community, in the Black community, and a lot of gum disease. And so that then results in a lot of lost teeth in the Black community.
And I grew up and thought that too, because my grandmother, when she would answer the door early in the morning, had no teeth. So then I asked my mother, "Are those yours?" And my mom said, "Our goal is to keep them, Renee." And I said, "Oh, okay, I can get with that. Exactly, I can understand that." But yeah, you're right. That's unfortunate. That's what we think. But
Yes.
we need everyone to know you can actually hold on to them for the rest of your life.
Yes. And I think that there's been a lot of advances and a lot of progress has been made, but there's still a lot to be done because unfortunately in underserved communities, in low-income communities, and people of color, that's where we see the disparities and the disproportionalities in access to care, availability of care, affordability of care, and acceptability of care. So it's a collective effort if we're really going to try and address the oral health disparities.
So I guess my question is, first of all, explain exactly what the cavity is. And then I have another one after that.
Okay, so in our mouth, we have bacteria. You have what's normal bacteria that's there. We've got spit or saliva that's in the mouth. And so that helps with keeping the mouth moist and moving things, keeping things flowing. But too much of anything, it can be bad. And so if you eat a lot of sugary sweetened beverages, a lot of sugar sweetened foods, and drink a lot of sugar sweetened beverages, that increases what we call the bad bacteria that can cause cavities that can result in gum disease. And so what cavities are like, they'll start off as little spots. They can be little dark spots, brown spots that will start to occur on the teeth. And over time, this is not something that happens overnight, but over time, they are eating away at the enamel, which is what we call the outer surface of the teeth. And once they work through or break through that, then they're working their way through the different layers of the teeth. And sometimes people don't notice it, particularly if it's in your back teeth or what we call our molars, until all of a sudden you may be eating something and you feel a little sensitivity, or and that's when, at that point, it has become a cavity. We have what we call incipient lesions, which are those small ones which haven't naturally broken through all of the layers, but it is something that is forming and developing.
And I was going to ask you, was it true about the sweet candies and stuff? So apparently it is true.
Yes.
Please be careful. So unfortunately, as we both know, if you don't have a whole lot of money and you don't have anybody's insurance, you're really not worrying about your teeth. So can you explain the importance of people going to the dentist, even though your teeth are not hurting? Because a lot of people wait until they're in pain to finally go
Yes.
see the dentist.
Some people feel like, well, I brush my teeth every day. We talk about flossing and flossing the teeth, and majority of the population does not floss. But the importance of flossing is that even when you're brushing, the toothbrush can only do so much. The toothbrush and those bristles, unfortunately, cannot get between the teeth. That's a good thing because we want you to have those tight contacts or that close proximity. But the floss will serve to go between there like a little fine piece of thread to remove any particles that may be there and that may be under the gums. So using those in harmony with the toothbrush helps to prevent you from having a buildup. But again, the toothbrush can only do so much. And so by going to the dentist on a regular basis, and what do I mean by regular basis? At least twice a year, every 6 months is what is the prescribed recommendation, so that you are being looked at by a professional that is looking and examining your teeth, hopefully to be proactive. So if something is forming, they can get ahead of it before it becomes worse and it starts causing you pain. And then taking x-rays, because there's only so much that the naked eye can see. But with taking the x-rays, you can see if something is going on between the teeth or something is going on underneath the gums. The teeth are held in by bone, and so we want to keep that bone strong. And by taking the x-rays, you can see if you're starting to lose bone around those teeth. And again, be proactive so that you don't wake up and all of a sudden your teeth are loose. And this is something, again, that has happened over time that you were not cognizant of and was not on your radar because you weren't going to the dentist on a regular basis. So we don't just say that because we want your money. We're saying that because we're trying to help you
Right.
with keeping your mouth healthy and keeping those teeth that are made to last a lifetime.
Now, this is the craziest question, but I am one of those people that didn't like going to the dentist until the dentist I have, before the ladies I have now. I was petrified. But my dentist was like, the dentist shouldn't be a painful experience. I said, it shouldn't be.
Exactly.
And sure enough, because my first visit to my new dentist as an adult, my first dentist, bless her heart, she was fabulous. But she said, you need a filling. I said, I'll reschedule and I'll come back and do that later. And she was like, but you're here and your job knows you're here, right? And I said, yeah. She goes, well, let's just do it now. I go, no, you don't understand. I have to mentally prepare myself for this. And this is not really something I can easily just walk into right now. I'm not ready for that. She was like, I promise it won't hurt. And I was like, okay. And sure enough, it didn't. She did all sorts of stuff, numb this, that. And I was like, I called my dad. My dad goes, you got a filling today? I said, exactly, Dad. I just was going for a cleaning, but she did it. And he goes, and you're okay? I said, I'm driving back to work. I'm fine. He said, wow. Because he knew I am awful. Mm-hmm. So can you reassure people so that because that's the other thing. I know people don't go to the dentist because they're terrified.
Going to the dentist can be a painful experience, but that's typically when you have waited and you're actually in pain. But going to the dentist does not have to be a painful experience. And unfortunately, a lot of times people associate the dentist with pain. And that may be based upon their personal experience, or it may be based upon stories that they've heard. Well, no, my father went and said that they almost killed him and they couldn't get him numb and they had to take the tooth out. And so I know that it's going to be painful. And what ends up happening is that myth then transcends to the children, and the children don't go. So it creates a generational fear of the dentist. And so that's why we really try and promote from maternal health and from infancy, incorporating, just like you have to go to your physician to get routine checkups, even as a child, going and getting your wellness checks and getting immunization, making going to the dentist an early process and part of it, so that it becomes, again, you're doing everything you can to be preventive and proactive and creating that experience of, oh, I went to the dentist and it was fun as a child. And the children will look forward to, when am I going to the
Yes.
dentist? When is my next dental appointment? So that they become excited.
Yeah.
Excited
And
about it.
there's an importance for them to go before they have their adult teeth, right?
Exactly.
Okay.
Exactly. So typically when children start, when they, the teeth start coming in, and so we usually say between 2 and 3, go ahead and start letting them, go to the dentist just to make sure that everything is going okay. And the same thing with children as they develop that full complement of teeth, then taking them every 6 months so that they can get cleaning and they get fluoride, and you're checking the teeth as well, because children are growing, and as they're growing, they're not just getting taller, but their jaw is in their face, everything is growing. The hands are growing,
Right.
the feet are growing.
Right.
So that doesn't exempt the mouth from growing. And sometimes they can have instances where maybe the bottom jaw, what we call the mandible, may be growing faster than the top, which could affect their occlusion, their bite. And so being able to monitor their progress, just like you're monitoring their physical
Yep.
progress with your physician, you do the same thing with the dentist. Again, the head is connected to the body.
Yep.
And so take care of both of them.
So as a doctor from Meharry Medical College, how does this institution contribute to addressing our oral health disparities, particularly within the Black community?
Well, we don't just say that our motto is worship of God through service to mankind and having an emphasis and focus on underserved communities. That's what we actually believe in, and that's what we actually practice. So a part of our curriculum is not just about making certain that they have the foundational information so that when they leave here, we don't say that we're graduating dentists, we're graduating oral health care professionals. So a part of the curriculum is what we call community-based education. And so they're actually engaged in the community, and they're providing clinical care in community-based clinics that we have through partnerships. The other part of that is that they are being involved in organized dentistry. So they get the opportunity to understand how policies that are being made not only affect dentistry, but they affect the communities that they're going to serve. And by going into the communities, they're able to understand, not just looking at this person and saying, okay, they don't have any teeth, so I need to make them a denture, but understanding the environmental factors that attribute to that, understanding the behavioral components of those patients, the cultural beliefs, because all of those things play into the communities and the patients that they're going to serve. So we want them to see the patient as the whole patient, understanding their health history and what medications they're on, what attributed to those to them being on those medications, and how that impacts what's going on in their oral health. And so we talk about, as a part of the curriculum, social determinants of health, political determinants of health, so that they understand that if they're going to be an oral health care provider, they're going to be a leader in the community, but they have to understand the communities. They have to understand the decisions that are being made and the impact that has on that community as well as on the profession.
So do you, because I know that I've heard, because I live in Chicago, and I know that you can go to the UIC, I think it's UIC's School of Dentistry, and you can go for cheaper and get your teeth cleaned. Do you guys have programs like that here at Meharry?
Absolutely. All of our fees are less than what you would experience if you went into a private practice.
Okay.
But all of our procedures, everything that is done, is monitored by licensed, experienced clinical dentists that we have, that our faculty, all of our faculty that are dentists are licensed. And so everything that the students do, it is being evaluated by our faculty. So they are being guided by experienced dentists. And so it takes a little longer.
Of course.
But it's also more cost effective.
Mm-hmm.
And so that is one option for people who can't necessarily afford to go to a private dentist, but they're getting quality work, superior work, at a reduced cost.
Okay. Yeah. That's why I said, I think, it's the same with the beauty college. I mean, it's,
Absolutely.
you're getting all these extra people
Yes.
looking, so that's always better. So,
Yes.
I think that's great. And that'll help people that cannot afford it for whatever reason.
I think too, because when you're going to a school and getting the work done, and let's say that you need consults from different specialists, you have that right there. Versus if you're in private practice and then you've got to get a consult, then that's another appointment and
another
additional
place.
costs.
Yeah,
and
you have to get there.
Yes,
transportation may
because
be an issue.
In most instances, you don't have all of the specialties under one roof, under one umbrella. At the dental school, you do.
Yeah. So, what role does mentorship and representation play in encouraging Black individuals to pursue careers as oral health professionals?
Mentorship is very important. When we think about the Black community, and we make up approximately 14% of the U.S. population, and when we talk about dental care, and it's the same thing with medicine, we only represent about 4% of the profession. And so it is not unusual to talk to children and they've never seen a Black dentist or a Black physician. And so it's important for us to reach back and inspire and encourage the next generation to look at this profession as a viable profession, as a way that you can have a lucrative lifestyle. You can help the community. It is a profession that has a great need in the community, and so you're making a difference. And so there have been studies that have shown that people, when they have a choice, are more likely to choose a healthcare professional, a dentist or physician who looks like them. Well, if they don't have that option, or they don't have that choice, then that limits. And that study also says that they're likely to be more compliant, because there's a connection and there's that cultural competency and cultural sensitivity that we talk about, because they feel the connection. Well, I'm Black, you're Black. There's some things that you're going to understand. Something is minor as what we call pigmented gums. Not everybody's gums are pink. And particularly in our community, you may have pink and brown, or it may be dark, but having someone that understands that. And so a part of, again, what we do as a part of our curriculum is we have partnerships with middle schools and with high schools. We actually have a middle school where we go in and we do mentoring. We actually have a dental chair there. And so we go in and allow the students to see people that look like them, that came from communities like them, that are on this journey to becoming a doctor, and letting these kids put the white coat on and see themselves in a white coat as a possible doctor. And then mentoring at the high school level and even at the college level too. But we think that it's important to do it at all levels, because you miss so many if you wait until high school, because so many of them, by the time they've gotten there, their ideas or their focus has already been formulated.
Right.
And so really starting at elementary and middle school. And so we have programs that we do that throughout the life cycle. And the important thing is that we don't want students to wait until they become dentists to decide that, oh, I'm going to be involved in the community. From the time that they are accepted, from the time they step foot on this campus, that is a part of their 4-year journey. But we also, when we're selecting students, we want to make certain that we're looking at for students that are going to be compassionate. Yes, you have to have the
GPA or
yes,
whatever.
you have to have
test
that.
scores.
But you have to be able to effectively communicate. You have to be able to demonstrate that you're concerned and you're compassionate about the community and that you're actively engaged. And so those things don't happen overnight. But we want to make certain that when they're in school during their 4-year matriculation, that's embedded, so that they are more likely to continue those types of initiatives and endeavors as they go into the career as a doctor.
So for dental school, can you tell people what is the test that they have to take to get into for the application process?
So the application process includes what we call the dental admissions test. It is a standardized test. They take that while they're in college. And then, so we stress having a strong GPA. The majority of our students are science majors, either being biology or chemistry, but you don't have to be. but there are science courses that you have to take, what we call our prerequisites that have to be taken. And so doing that, taking the dental admissions test, having letters of recommendation, you have to do an essay that asks you questions about your involvement throughout your undergraduate matriculation that you complete. The one thing that I do want to emphasize is that if we say that the deadline is December 15th, don't send the application in on December 14th or December 15th. The application cycle typically opens the end of May or June. The early bird catches the worm. Apply early. And that's what we do see a lot of times, is that people will think, oh, I've got time, because the deadline is typically by then we already have gotten thousands of applications, because we get over 3,000 applications, and you're talking about for 75 spots.
Oh my goodness.
So it's very competitive. And so you want to apply early.
Mm-hmm. Yeah. Oh my goodness. Yeah, that's not a whole lot of spots. And it's awful that people want to wait to the last minute. As someone involved in educating the masses, how do you see media and public health campaigns like this helping our oral health disparities?
I think one of the things is that education is key, and knowledge is power. And a lot of times, people don't know. And I want to give an example. And it's not just about knowing the importance of taking care of their teeth, but knowing how to even navigate that. And I'll use in Tennessee, and across the country, we always take care of the children and have resources available for children, whether it's the CHIP program or Medicaid program. Unfortunately, it then changes when it gets to the adult as it relates to dental care. Mm-hmm. And one state may offer it, another state may not, because those are state decisions. But in Tennessee, for example, we expanded adult to include adult dental care as a part of the Medicaid program. In Tennessee, it's called TennCare. And that was great and wonderful, because you have thousands of people who now will have access to dental care who did not have it before. Now, the challenges of that is that, one, do you have enough providers that are going to actually accept this coverage? So providing that, and then you still have the challenge of some people still having to travel as far as 60 miles to find a dentist who would accept this Medicaid insurance. But even before you get to that, you have the situation where, okay, how do I apply for this? Okay, you need to go online to do that. They have not a clue of how to do that. And so I think in something like that, that's where having a collaborative effort, so having community activists that are helping to educate them and show them and assist them in being able to apply. They're eligible, but they don't know how to apply for it. Or they may not have even known about it. If they had known about it, they would have. So having, not just making it available, but developing the plan for how we're going to make certain that the people that need it, the most vulnerable, the underserved communities, will know that this is available. They will know how to access it. And then assisting and providing providers that will then, that they will be able to see. So that goes into the acceptability, the availability of it as well, and accessibility.
Yeah. Wow. Well, that like I said, anything to help increase that. So can you stress the importance, because you've said it, but stress the importance of oral health care with the other systems in our body?
So when we talk about oral care, and we can say, you need to take care of your teeth, but studies are shown, and it's wonderful now, wonderful that the knowledge is there, that what is going on in your mouth is associated with cardiovascular disease, with heart disease, that is associated with diabetes. And that, because you have to think about, you have this bacteria in your mouth, and this unhealthy bacteria, it can get into your bloodstream through your gums. Mm-hmm. And then if it gets into your bloodstream, it can travel to your heart, and it can impact heart disease. So for those vulnerable individuals who have heart disease, and then having that couple disease going on in their mouth. With diabetes, the same thing. And even now with Alzheimer's and being associated with Alzheimer's
Oh, wow.
as well. So it's important. And that's what we talk about oral systemic health, or medical and dental healthcare providers working together and collaboratively, so that, you know, you think about it, when you go to see your physician, they will have you to open wide. They got to go past the lips, past the tongue, to look at the posterior of your mouth.
Right.
We don't need them to examine, but being able to, and a part of what curriculum is really being pushed in medical and dental schools, is to have more collaborative and more intentional evaluation and diagnosis, whether it's in medical school, whether it's in nursing school, so that you know what puffy gums look like and can discuss that with the patient. Is that you're just asking simple questions of, when was the last time you saw a dentist? Do you have a dental home? And that's one of the things that I personally have been trying to push as a part of. You think about it, when you go in to your physician, they have all of these questions about your medical history. In the majority of instances, they don't have questions about your dental. And basic questions of, do your gums bleed when you brush? Do you have sensitivity to hot and cold? Is your neck stiff, or does your jaw hurt when you wake up in the morning? Are basic questions that could be asked. Do you have a dental home? When was the last time that you went to the dentist? That could be included, should be included, so that it's a collaborative or collective effort. You know, if a patient comes in and we take their blood pressure, and the blood pressure is high, and they've got, and they may not have a history, but depending on what it is, we will refer them
Yes.
to a physician. It needs to be the same thing with physicians, so that it's a collaborative effort. Because I think what we all want is overall health, optimal health, and that includes oral health, our physical health, and our mental health. Because mental health also is now being shown to be attributed to oral health can impact mental health.
I mean, if you're
depressed and
you're smile or
yes.
something, that can cause depression easily, especially in young people.
Exactly. And when you're stressed and you're clenching your teeth, and then you can end up with having cracked teeth or grinding your teeth, and you wake up and you've ground your teeth down, and now they're sensitive.
Unfortunately, I know a lot of people that sleep with
night guards.
Night guards. Yeah.
Yeah.
So, look, life is rough. and teeth are expensive, in case you didn't know. So don't grind your teeth. Go get a mental health professional to help you deal with that, so you don't grind your teeth. But I wanted to ask you, what made you want to be an oral health professional?
Well, interesting story. Well, when I was in high school, because I initially thought I wanted to be a mortician.
Okay.
Interestingly enough, but when I was in high school, I had the opportunity to go to a summer program at a small college in Mississippi, Tougaloo College. And when I was there, it was for students that were interested in the different sciences, different health careers. And so I had an opportunity to shadow physician, OBGYN, so I knew quickly I did not want to do that. And I actually shadowed a dentist in a community health center. And so that's when I decided that's what I wanted to do. To see, it was two patients that I, to this day, and that was over 30 years ago, but I still remember them coming in. And one was a lady that I thought was a lot older, because she was edentulous. She didn't have any teeth. And she was coming in, so I had missed the extractions and all of that, but she was coming in to get her dentures delivered. And to see them be placed in her mouth, and the transformation of how, I mean, it took like 15 years off of what she looked like. And to be able to see that before my eyes was just remarkable. I still remember that. And I remember this big, stocky man coming in. And he had a toothache, had to get an extraction, and he was terrified. But the staff were just so patient with him, helped him relax. He got the injection, didn't feel it. He was in tears afterwards, but he was in tears because of the fact of how appreciative he was, and the fact that I thought this was going to hurt, and this was a breeze. I should have been in here a long time ago. And so so when I was in high school doing that program, made me decide that I wanted to become a dentist. And so going to college, I knew that was what I wanted to do, and just started on that trajectory. And programs like that really can make a difference. At the time, it was called, it was health HCOP program. Well, I didn't know what HCOP was. I just knew there was a summer program that I was going to. But to get to Meharry and then to find out we had an HCOP program and to be a part of that, and it's come full circle for me, because it's like that's how I was introduced into dentistry, and now I'm a part of a program that we have that's doing that same thing.
Awesome. Awesome. That is, but we Dr. Hildreth and I spoke about how it's so important for children to see things in order to become them. And, I think that they don't think about, dentist. That's another profession that they could think of. And so it's so important to have programs like that.
Absolutely.
Yeah.
Absolutely.
So are there any last words that you'd like to share with our audience about our oral health and
I think
health period?
Probably the biggest thing is that I understand that not everyone has resources, but there are community health centers that will offer free services or services at a reduced cost that's based upon income. Many of the community health centers will have dental services that are available for people that are, I know very few, if there's not a community health center or a health department within that particular city, there's one in close proximity. And then also dental schools are another avenue and vehicle for that. And for people that are in position of influence, doing the homework and the due diligence to make certain that there is oral health care coverage for all, not just for our children, but for our adults as well. If you're breathing, if you have a voice, you have power, and use that to the benefit of helping others and improving oral health for all.
Thank you so much for your time today.
Thank you.